Stop scrolling for a second, because what I am about to show you might finally change the way your back feels every single day. Most people think you need dozens of stretches, complicated yoga routines, or expensive physiotherapy sessions to fix your spine. What if there is one simple exercise, backed by body mechanics, used by physical therapists, recommended by posture experts, and proven to decompress your spine, that you can do anywhere in less than a minute, and it can literally transform the way your back feels? Just one move, one habit, one daily routine. For a pain-free spine? Your comment helps me tailor every video exactly for you. Welcome back, everyone. This is your friend from Upgrade Your Life. And as always, I'm here to help you live stronger, pain-free, and more energetic no matter your age. But listen, before we start, hit that like button right now, subscribe if you haven't already, and turn on notifications. Kyunke aaj ki video, wo wali video hai jo aapko literally years ki back pain se free kar shakti hai. Let's begin. Why your spine hurts in the first place. You wake up in the morning, back feels stiff, you sit for a long time, spine feels compressed. You bend forward, there's a pinch. You twist, something catches. Not because your body is old, not because you're weak, not because you need 20 different stretches. Your spine hurts because of one main reason: compression plus weak stabilizing muscles every step you take. Every hour you sit, every time you bend, your spine is under pressure. And when the core muscles supporting it become weak, the weight transfers directly into the discs, nerves, joints, and ligaments. Your spine is the same. The biggest misunderstanding about back pain: some do stretches every morning. Some even stay still thinking rest will fix everything. But none of that works unless one specific area starts functioning again: the deep spinal stabilizers. Especially the multifidus, transverse abdominis, and pelvic stabilizers. Doctors rarely explain this. Gym videos rarely explain this. Even many trainers misunderstand this. But physical therapists know the truth. If the spine stabilizers activate, 80% of back pain reduces naturally, which leads us to the one exercise that changes everything. Yes, there is one move that activates all these stabilizers together. It decompresses your spine. It improves posture instantly. It strengthens the core without crunches. It stops disc pressure. It reduces nerve irritation. It teaches the spine how to support itself again. And no, it's not planks, not yoga cobra, not child's pose, not bridges. It's something more powerful, something more foundational, something that humans have naturally done for thousands of years, but modern lifestyle killed it. The only exercise you need for a pain-free spine, the exercise that fixes decompression, stabilizes your core, lengthens your spine, and wakes up muscles that have stopped supporting you. What matters is how it makes you feel. Why this one move works better than others: because it realigns the spine naturally, activates deep back muscles, encourages proper posture, releases tight hip flexors, improves circulation to spinal tissues, reduces nerve compression, strengthens without working out. Let's break it down step by step. Step 1. Positioning: lie down on your stomach. Place your elbows under your shoulders, palms flat on the floor. Your body will look like a sphinx pose, but with one crucial difference we'll add later. Your spine is straight, your hips relaxed, chest open. Now breathe in through your nose, slow and deep. Step 2. The activation: now gently press your elbows downward into the floor. You're not trying to lift, you're not trying to bend too high, you're not forcing anything. You're simply creating pressure through the elbows. What happens next is the magic. This pressure travels up the arms, into the shoulder girdle, into the thoracic spine, and finally activates the muscles deep near the lumbar spine. You'll feel a light lengthening in your lower back, not a pinch. If it pinches, lower your chest a little. This should feel like relief, not pain. Step 3. The spinal elongation. As you breathe out, imagine someone softly pulling your head forward from the crown. This creates gentle elongation, the key to decompression. Do not lift your neck. Do not look up, just lengthen. This single action takes pressure off the discs. Most people feel immediate relief. Step 4. The hold the position for beginners: 15 seconds, moderate, 30 seconds, advanced, 45 to 60 seconds. Repeat 3 to 5 times. That's the entire exercise. But when you do it correctly, your spine wakes up. Your core stabilizes, and the pressure melts away. This is the one move physical therapists use for early-stage disc issues, nerve pain, posture correction, and postural strengthening. What you should feel: mild stretch, light pressure release, warmth in lower back, space between vertebrae, breathing becomes easier, mobility improves when you stand. If at any point you feel pinching, stop immediately and lower yourself. Why this exercise is enough: because it does the job of yoga, stretching back, strengthening posture correction, disc decompression, nerve relief, mobility work, core activation. People spend 30 minutes doing 15 different exercises. This simple routine does it better in 60 seconds. Consistency beats intensity. Do it daily and your spine learns to support itself again. 1. Reduced lower back pain. The primary reason many adults experience stiffness or discomfort is because the deep spinal stabilizers are weak or inactive. The spine reset wave targets these muscles, such as the multifidus and transverse abdominis, reactivating them. When these stabilizers are engaged, they reduce the pressure on the lumbar vertebrae, helping to relieve pain. How it works: as you perform the wave, the movement gently compresses and decompresses the vertebrae, improving lubrication of the spinal joints. Practical tip: focus on engaging the lower abdominal muscles during the pelvic tilt phase. A slow and controlled movement ensures the correct muscles are recruited. Expected outcome: within a few sessions, users typically notice less tightness after sitting, standing, or bending. 2. Improved mobility. Reduced mobility in the spine can lead to compensatory movement patterns, where other muscles overwork to support the spine, often causing pain in the hips, shoulders, or neck. The spine reset wave restores natural movement along the thoracic, lumbar, and pelvic regions. Thoracic mobility. The upward wave motion helps open the mid-back, improving spinal extension. Lumbar mobility. Gentle posterior and anterior pelvic tilts allow the lower back to move freely. Hip mobility. Controlled pelvic rocking releases tension in hip flexors and glutes, supporting better movement. Practical cue: maintain slow, rhythmic motion. Never force the range. This ensures safe, progressive improvement. 3. Postural alignment. A misaligned spine contributes to fatigue, chronic tension, and inefficient movement. The spine reset wave strengthens postural muscles while reinforcing the neutral spine position. Upper back. The thoracic portion extends during the wave, counteracting slouched posture. Core support. Engaging the deep core muscles allows your pelvis and lower spine to maintain proper alignment. Spinal awareness. Performing the exercise regularly trains your nervous system to remember correct posture throughout the day. 4. Core stability. Core stability isn't just about visible abs. Deep core muscles stabilize the spine and pelvis. Without activation, even light movements can trigger pain. The spine reset wave activates transverse abdominis, provides a corset-like support around the spine. Pelvic floor maintains pressure balance and aids in proper spine alignment. Diaphragm supports breathing mechanics while engaging the core. 5. Stress reduction. Chronic tension can lock the spine, and tight muscles often increase stress levels. The coordinated breathing in the spine reset wave activates the parasympathetic nervous system, promoting relaxation. Technique: inhale as the spine extends, exhale as the spine flattens during the wave. Result: increased oxygenation, reduced muscle tension, and overall calmness. Exercise variations. Expanded beginner variations. Perform smaller waves, 10 to 15 reps per session. Pause for 1 to 2 seconds at each pelvic tilt to focus on deep muscle activation. Use a pillow or small rolled towel under the lower back for support. Focus solely on the lower spine until the movement feels natural. Advanced variations. Extend your legs fully to increase core engagement. Elevate your arms overhead to engage thoracic muscles. Place a foam roller under the mid-back to enhance spinal extension. Incorporate a slow twist at the upper spine to improve rotational mobility. Gradually increase repetitions to 30 to 40 per session as control improves. Tips for progression. Track your daily mobility and comfort levels. Increase wave amplitude slowly. Never force range beyond your comfort. Pair with light stretching for a full spinal and hip release. Common mistakes? Expanded explanation 1. Moving too quickly. Speed decreases control, prevents deep stabilizers from activating, and can strain superficial muscles. Correction. Perform the wave slowly, focus on muscle engagement, and maintain smooth rhythmic motion. 2. Engaging only superficial muscles. Many people overuse glutes or rectus abdominis instead of deep stabilizers. Correction. Place your hands on your lower abdomen to feel the transverse abdominis engage and maintain pelvic control. 3. Holding your breath. Breath holding increases tension and reduces circulation. Correction. Inhale as you extend the spine, exhale as you flatten the lower back. Diaphragmatic breathing enhances muscle activation. 4. Arching the neck. Cervical strain can occur if the head is lifted or bent excessively. Correction. Keep the neck neutral, gaze upward, or place a small pillow under the head for support. 5. Skipping warm-up. Cold muscles reduce mobility and increase risk of strain. Correction. Perform 1 to 2 minutes of gentle hip circles or leg swings before the exercise. Recommended frequency and duration daily practice. 1 to 2 sessions per day, each lasting 5 to 10 minutes. Consistency. Small daily doses are more effective than long, irregular sessions. Progression. Gradually increase repetitions and range of motion as control and comfort improve. The long-term benefits of this stretch are significant. With consistent practice, you will notice reduced neck stiffness, less shoulder tension, improved posture, and greater mobility in everyday movements. Daily activation prevents deconditioning of deep muscles, supports proper alignment, and reduces stress-related tension. Breathing coordination enhances relaxation and oxygenation, improving both physical and mental well-being. High retention tips for maximum effect include performing the stretch in front of a mirror to ensure correct alignment, pausing the video to follow each step carefully, pairing it with light shoulder and upper back stretches, and gradually increasing hold time or repetitions as comfort improves. Encourage yourself to notice incremental improvements, which reinforces motivation and consistency. This 1-minute stretch is all you need for effective neck pain relief, requiring no equipment, no long routines, and no expensive therapy sessions. Start today by committing just 1 minute daily, focusing on slow, controlled movement and mindful breathing. You'll gradually notice improved posture, reduced stiffness, and increased comfort. If this stretch helped you, click like to support others finding relief, and subscribe for more practical, science-backed exercises that really work. Your neck can feel free, mobile, and strong. With consistent practice of this 1-minute stretch, you can restore confidence, reduce tension, and enjoy daily movement without pain.